Welcome to Deuk Spine Institute live stream for spine surgery. It is September 26, 2024. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. Our patient comes to us from New Mexico. It's our first live stream this morning. We've already done 2 surgeries. One of the surgeries did not want a live stream, so we respect the patient's wishes. And the second surgery was done in an operating room where we don't have cameras, so we can't do a live stream. So this will be our first live stream for today. Our patient has multiple causes of back pain, specifically 2 discs and some other causes like facet, but also piriformis. We're going to be treating the piriformis as a second live stream. We're going to start with the Deuk laser disc repair. She has 2 discs that are damaged, L4-5, L5-S1. Follow along, and if you have questions, feel free to ask me. And I will do my best to answer your questions. Am I missing something here? All right, let's get started with the Deuk laser disc repair. And if you have questions, type them up, and Henry will ask me, and I will do my best to answer them.
Of course.
So, we're going to first, what is that noise? Is that really the hip shot? All right. A little bit too lateral there. So she has a high hip. Shot? That high hip. She is an example of why L5-S1 is so challenging. Shot? It is because the hip bone. When I mean by the hip bone, I don't mean your hip down here, I mean the hip up here. Is that it? All right. So I'm going to be trying to get into the L5-S1 disc. Our patient is still, Luis, I need some help here. Where's the medicine I'm supposed to be injecting?
Yes, sir.
This?
Mm-hmm. Yes. Yes, sir.
Okay. Some numbing medicine. Any questions?
At this moment, no current questions.
Well, since our patient is from New Mexico and has more than one cause to her back pain, let's show the audience just what are those causes of back pain that people can get. And there are about 30 of them that we've seen over the years commonly. And Henry, do you mind sharing that with the audience?
Not a problem.
I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint causing 10% of the chronic pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us.
You can see from the animation you just watched that lower back pain, chronic back pain, meaning it's been there for more than 6 weeks. She's had back pain for 30 years on and off. Really bad over the last 6 months. But basically, chronic back pain, the most common cause, number one, is a disc injury. We discovered that here at Deuk Spine Institute. I discovered it. Disc injury. Okay? Disc injury. And that accounts for 87% of the main causes of back pain, 87% of the time. So if somebody comes up to you and says, I got back pain, you know about 90% chance, 9 out of 10, it's disc, or 2 or 3, you know, however many there are. In her case, she has multiple discs. We now have our needles inside 2 of the discs that we're fixing today. We're going to verify whether or not these discs are the cause of her pain. And the way you do that, the only way to do that is a discogram. Or fix it and see if the pain goes away. Are you comfy? Are you ready to go to sleep and get your back fixed? All right, I just need your help for a minute. Let me know if are you having any back pain right now? Nope. Shot? How bad is that on a scale of 1 to 10? 9? Is that where you get your back pain? Yeah, good. 9 out of 10, 5-1, it's concordant, meaning that's where she gets her pain. Is it better now? All right. Any more pain? Nope. All right. How bad is that on a scale of 1 to 10? 10? Yeah, she said 10. So 4, 5 is a 10 out of 10. Is that where you get your back pain? All right. When you wake up, that pain will be gone for the rest of your life. We're going to fix it for you with the laser. Nighty-night, count from 1 to 100 out loud so we can hear you. Count from 1 to 100. So while she's counting, we'll put her to sleep. When she stops counting, she's asleep. You can see the dye has leaked out the back. It's going along the nerves. So you can see it tracking along the nerves and soft tissues, the fat. Show us the tears in the back of the disc, Jordan. There's a tear at 5-1. 5-1 is more collapsed. It's an older injury. 4-5 is a newer injury. You can see the dye in the middle of the disc leaking out through the tear. Okay, if you have questions, feel free to ask them. But otherwise, Henry, I'd like you to show our audience how is it that these disc injuries can cause so much back pain while we get started.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. From our animation, you can see the cause of back pain from a disc injury is the tear in the back of the disc. And that tear can be found using the endoscope, the endoscopic system we use. And then you can use a laser to clean the tear and get rid of the herniation that's stuck inside the tear. That's the tear and herniation causing all the back pain. That's what we're going to fix. It also causes leg symptoms like weakness, numbness, and tingling by pinching the nerve. Wow, that tear is huge. The dilator just went in so easy. I mean, like nothing. I barely hit it. So huge tear, huge tear. This, I think, is the reason why she has the back pain that flared up in a few months ago, like 6 months ago. Shot? All right, we are inside the disc, and now we're going to go and clean out the tear so that the disc can heal. It is the tear that is the cause of her back pain from the disc. She has other causes of back pain too. We're going to get into that later, like the piriformis. Have we shown the audience yet how we fix these tears?
Not yet. We have
Why
not.
don't we do that as we get started to fix the first one?
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from our animation, we use a tiny little tube to get to the tear in the back of the disc without doing any damage to the body, except for the skin incision, which is a 7mm incision, which heals quickly, by the way. The skin incision is easy. It's just a little scar. And we don't lose much blood. On average, we lose about 1 cc, which is 20 drops of blood per surgery. Very, very little. The patients go home the same day. This patient literally is going to go home in an hour, after an hour recovery. Oh, what do I hear in the background? What is that? Sorry, we have an intermission. We have some music coming on, and it is the Scorpions. Rock You Like a Hurricane. Wow, that's awesome. So why are we listening to Rock You Like a Hurricane? Because we are in a hurricane right now in Florida. Hurricane Helene. Helene. Hurricane Helene is hitting the Florida coast as we operate. And fortunately, we're on the Space Coast, which is the East Coast. But we're going to enjoy Rock You Like a Hurricane because we're getting rain and a little bit of wind at this point. All right. So, as I was saying, the endoscope allows us, you can lower it a little bit. The endoscope allows us to find the tear and use a laser to clean the tear, get rid of all the junk stuck inside the tear. That is what we're doing at this exact moment right now. This stuff right here is herniation stuck inside the tear. All right, Henry, we'll take our questions.
Yes, this question coming from Robert on YouTube, asking, how do the disc spaces with significant collapse respond to this procedure compared to those that are not so significantly collapsed?
Yeah, it turns out that this disc space height and size has nothing to do with symptoms at all. As a matter of fact, there's no reason to do anything with the disc space. Unfortunately, most doctors don't know that, and they're going to try to tell you you need a cage or an artificial disc put in there, but you don't. We've been doing this surgery now for 19 years almost, and in 19 years of doing this surgery, we've never had a problem with collapsed disc space. Patients have zero symptoms from it. It's kind of like having wrinkles on your face as you get older. There's nothing that needs to be done about it, but some people just can't live with wrinkles, and they got to have them fixed. But that's for psychological reasons, not for any type of disease. Wrinkles don't cause disease unless they're affecting your vision. So, having a collapsed disc is like having wrinkles. You leave it alone, it doesn't do anything, doesn't cause any symptoms. But there are doctors who will prey on people's insecurities and offer treatments for things that don't need to be treated. And it will ease people's anxiety. Freud was the one who discovered that anxiety drives all human behavior. People being afraid of something. All right, any other questions?
At this moment, no current questions, but we do have a comment coming from Equity King on Facebook.
Hello, Equity King. Thank you.
Saying, you are a real inspiration to me. I hope one day I can be a neurosurgeon. I watch all of your videos on a daily basis. You are really amazing.
First of all, thank you so much. Flattery will get you everywhere, as they say. I appreciate it. But I want you to understand what I do here today for you, I couldn't do without an entire team of people. We have 75 employees at Deuk Spine, 75. It's a lot of mouths to feed, but everybody is important and everybody helps to make this possible. So I appreciate you feeling that way about me, but I couldn't do it without a lot of good help. So thank you. And I hope you make it. I hope you make it to be a neurosurgeon, and I hope you come work at Deuk Spine someday. All right, Henry, any other questions?
No current questions, but we do have one more comment coming from Greg on YouTube saying, good morning and good luck.
Hey, Greg. Good morning to you, Greg, on YouTube. Thanks for the sentiment, and I appreciate it. Thank God luck is not too much of a factor. We don't really roll the dice on these cases. We know, we can lower that. We know that these procedures work. That's the beauty of them. They work. They work every single time. As a matter of fact, we've never had a failure where it didn't work. Where there was the Deuk laser disc repair, getting rid of back pain, or it's the Deuk piriformis release, getting rid of piriformis pain, or it's the Deuk plasma rhizotomy, getting rid of, joint pain, facet joint pain, SI joint pain, whatever it is we're treating. They work every single time. And the reason they work is simple. Good medicine, right? Good medicine. We understand the basis of pain. And that's what the 30 causes of back pain video is all about. If you watch that video, you'll see that there are 30 things that can cause back pain, chronic back pain, and those 30 things each have a fix. Okay, they're not going to fix themselves. People want to believe they fix themselves. They don't. They get better on their own. Sometimes when you rest, take it easy, your pain will subside, but the actual source of pain, the injured muscle or joint, will never, ever, 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 ever heal on its own. And I'm not saying that because I don't want it to heal. I want it to heal on its own. I don't mind. I could retire and I'll not have any work, but the truth is they don't heal. And people want them to heal. Physical therapists will tell you they'll heal, but that's because the physical therapist tells you you need to do physical therapy and it'll heal on its own. But that's because they want you to pay for physical therapy, okay? And those people doing shots will tell you, oh, shots are a good treatment, it can help it heal. But that's because they want you to pay for their shots. And the truth is, if you ask them, physical therapists, pain management doctors, anybody treating chronic back pain, will your treatment cure my pain and eliminate it permanently? They will all tell you, no, unlikely, it's not going to happen, except for Deuk Spine. We will get rid of your pain. Now, here's the thing. We have some patients who, for whatever reason, and I won't go into detail on it, but they don't do all the treatments we recommend. And if you don't do everything we're recommending in terms of treatment, you're not going to get rid of all your pain. You're still going to have pain. And that pain can get worse as you get more active, right? So, for example, we have patients who, I'll just say, their insurance may not cover the thing we recommend done. So they can only do about half the things we're talking about doing. Well, in that case, of course, they're still going to have pain afterwards. There's nothing we can do about it. They can't do anything about it. We can't do anything about it. We can't operate for free, obviously. We have 75 employees we have to pay. Our overhead is massive. So we have bills to pay, and we need to be able to pay those bills. So basically, what it comes down to is if you have pain in your back or neck, thoracic, we can get rid of it, but we need to know where it's coming from, and we need to fix all of the sources. Otherwise, you're still going to have some pain after we do your surgery, okay? And we do have patients who don't do everything we recommend. And most of them are understanding that they're still going to have pain, and some of them are not so understanding and blame us. That's all I'll say. All right, Henry, do you have any other questions?
Yes, these next two questions are coming from Asim on Facebook.
Hello, Asim. Welcome. Welcome to our live stream.
First question asking, the slip disc problem can reoccur after surgery and the pain can restart?
Yes.
Please explain.
Yeah, so Asim, I'm going to talk about this surgery because when you ask me a question, can the slip disc problem reoccur after surgery, there are hundreds and hundreds of surgeries that you can do. There's so many. And I'm going to talk about the one we're doing right now. This is the best surgery in the world for a slip disc. There is no better surgery. And this surgery does have a reherniation rate of 1%. That means out of every 100 surgeries I do, one patient will have another herniation. Okay? And I will tell you that that's always because the patient does something they're not supposed to do. Whether they're taking a very big dog for a walk and the dog pulls the leash hard and makes the patient lurch forward, or they lift something heavy like a bag from the ground, something heavy like 30, 40 pounds, too soon. Whatever the reason, people break the rules and they bend and lift things from the ground that are too heavy too soon. So we tell everybody, wait for 1 year before you lift something off the ground that's heavy, like 40 pounds or more. Keep your lifting light. Let the disc heal. Let it heal. The disc takes time to heal. It will take 9 months to a year to fully heal. Until then, you can re-injure it. Every day it gets stronger and stronger, but the healing time cannot be sped up. There's no way to make it faster. You see this disc here that I'm operating on? Notice how there's no bleeding, right? There's no bleeding. That's because the disc does not have much blood supply. And you must have blood supply to heal. Must. Your body needs to use the blood system to heal. Without blood, there is no healing. You must have circulation to the tissues that are healing. This is herniation right here. It's stuck inside the tear. It's keeping the tear from healing. That's why I'm removing it. By the way, the laser fiber right there is 1 millimeter wide. So you can imagine the magnification here is very high magnification. Since that's 1 millimeter, we're done with this disc. Let me see. Maybe a little bit more right there. That's why we always look.
We have a couple more questions.
Yeah, give me a second. I'm battling a herniation
Of course.
that's sticking out. And look at it, it's calcifying too. See the gold color?
Yes, we do.
But what I was trying to say is that you can see the tear is much smaller now. When it was originally entered, it was about 6 millimeters wide. Now with my laser, and somebody asked me about this the other day, annuloplasty. We don't do an annuloplasty, we do an annular debridement. Annuloplasty is a shrinking of the annulus. We're not here to shrink the annulus, we're here to clean it. We want to clean all this junk out of it. This is material that shouldn't be here. It's stuck inside the tear, and it's keeping the tear from sealing. If the tear can seal, the pain goes away right away, but the tear will not seal on its own. It requires a laser to clean it. There's nothing else in the world that cleans the tear besides the laser. That's why, that's why the laser is necessary. People ask me, is the laser necessary? Absolutely, it's necessary. Is breathing necessary? Yes, right? Can't live without breathing. Oh, man, this is really interesting. A lot of herniation here. Man, this herniation, let's get the grabber. This herniation is in the foramen. We normally don't see this much in the foramen. There's a bone spur right there. You guys see that?
Yes, we do.
Laser. I wonder if I can grab that. Hold the tube where it is. Oh yeah, we got it. Nice. Hold the tube. There it is. Look what I just grabbed out. See this?
Yes, we do.
Light on. All right. That was sitting on underneath the nerve, what we call the axilla or armpit of the nerve. And that was a herniation right there. All right, let's see if there's anything left, and we'll be done with this one. And I will take your questions.
This next question coming from Asim once more on Facebook, asking if anybody does surgery of back disc, can he play any physical games like cricket, football, etc.?
Yes, we have athletes all the time. The best surgery in the world for a bad disc is the one you're watching. It's only here at Deuk Spine. Other doctors could do it. They could learn from me and do it. But right now, I haven't trained anyone. So until I do, you'll have to come here. That said, if you're an athlete, this is the surgery you want. There is no better surgery. This is curative of the pain, and it's the safest surgery available. It's the fastest recovery, and it lasts a lifetime if you let it heal properly, which you will. Anything else to treat this, like fusion, is going to make your back stiff and unstable. Fusion causes additional problems, complications. You don't want those. As an athlete, you don't want fusion. That would be the other option, fusion. All right, 30 seconds left for this disc, and then we're going to move on to the next disc. Next question.
Next question coming from Todd on YouTube. Todd asking if there is significant nerve damage due to a herniated disc, will the nerves recover after a surgery like this?
Todd, great question. The answer is typically yes, the nerves will recover after the surgery like this. But here is the problem. You have significant nerve damage from a disc problem. If you don't do surgery, the nerve damage will be permanent 100%. If you do surgery like this, the nerve damage 90% will recover back to normal, not 100%. In other words, you can get 100%, but there's a 90% of patients their nerve function will go back to being almost normal or normal. 10% will have permanent damage that cannot get better. Okay? So, again, surgery gives patients the ability to heal their nerve damage, and the nerve damage recovers back to a normal nerve. No surgery is guaranteed to be permanent nerve damage. Which would you want? I would want to give myself a chance of having a normal nerve. I would have the surgery every time. Now, it also depends on what surgeon is doing your surgery, right? If you have a good surgeon, you're going to have a good result. If you have a not so good surgeon, the results will be bad. So you have to choose your surgeon very carefully. All surgeons are different. None of them are the same. Just like soccer players. There are Messis, there are Ronaldos, there are Mbappes, there are, what is he, Swedish or Norway player? He's really good.
Ibrahimovic?
No. It's like Hansen or something like that. Anyway, and then there are a lot of bad players, right? And the thing about professional soccer is that you're only watching the good players. You're watching the best players in the world are on television. But there's a lot of bad players who are not on television. Anybody can be a soccer player. Surgeons, they're not selected because they're good at surgery. They're selected for whatever reason they're selected. Maybe they did good in school, they got good grades. Doesn't mean they're going to be a good surgeon. So there is no quality control for surgeons. Once they finish their training, they go out and they do surgery. And there's some very bad surgeons out there, very bad. So pick your surgeon very carefully. Next question.
Next question coming from Robert, once more on YouTube, asking, is this procedure covered by insurance?
Yes, Robert, this procedure is covered by many insurances, not all. It depends on your insurance plan. It also depends on who your adjuster is that gets the claim. So every procedure done in the world has coverage or non-coverage, but it's not all uniform. In other words, there is no procedure. Like even if you had a brain tumor and I want to take it out with brain surgery, some insurances will deny it, saying it's not covered. It should be criminal and illegal for them to do that, but insurance companies don't care about the laws. They only care about one thing: profit. Okay? And they will deny any surgery they can deny. They don't care about you as a person. They only care about money. They're not giving you medical care. They're just paying for your medical care. That's all they do is pay claims. Take your money and pay claims. We actually provide medical care, which is very expensive to provide. And if the insurance won't cover it, then we have some options to pay out of pocket with a discount. One insurance that will not cover this surgery right here is Medicare. Medicare will not cover the surgery, that's for sure. At least not in 2024. Now, I'm trying to change that. Let's see. I'm trying to get Medicare to cover it, but it is not easy to do. Hold on. Shot. So what's happened? Go ahead. What's happened here is the whole thing is moving. Shot. A little more. Unfortunately, some of the herniation is stuck between the tube and the...
Can I go over there?
Yeah. Stuck between the tube and the dilator. So we slid the tube down the dilator. Pieces of herniation stuck in there, and now we call it cold welded together. Shot. All right, well, I think you're getting it, Luis. There we go. Shot. All right, thank God for Luis. It's not just muscles, it's really technique. Right, Luis? It's the twisting. It's the way you twist and the way you pull. It's all about technique. Any other questions?
Yes, we have a question coming from Katie on YouTube.
Ping.
Katie.
Okay.
Katie asked, how often can the L4 to S1 area become herniated?
How often can the L4 through S1 area become herniated?
Correct.
Well, I'll be honest. L4-5, L5-S1 are the most common discs to be herniated. If you are over the age of 40, there's about a 90% chance you have a bulging disc or herniated disc at L4-5 or L5-S1. L4-5 is the most common. L5-S1 is the second most common. And most patients have zero symptoms. No back pain, no leg pain, nothing. And we don't treat those discs when they're herniated or degenerated, but no symptoms. We leave them alone. There's no reason to have treatment if you're not having symptoms. Symptoms or signs. We use the word symptoms all the time, and a symptom is actually what a patient complains about. But there's also signs that we look for as doctors. Sign is what we find on the physical examination. For example, if you have no symptoms from a herniated disc, you come see me and I do an examination, I might find some weakness in your legs from a pinched nerve from the herniated disc. Herniated discs pinch nerves all the time. And if your pinched nerve is being pinched bad enough, you're going to have weakness in your leg. If I find weakness in your leg and I ask you, do you have any weakness? You say, no, I'm fine. I have no numbness, no weakness, no pain. Then you have no symptoms. But you have signs, which is weakness on exam. So as long as the patient has no signs and no symptoms of problems from the disc, hold it, then they don't need treatment. Yeah, remember we talked about wrinkles, right? Everybody gets wrinkles as we get older. Everybody, without exception. And the only wrinkles that really need treatment are those that block your vision. You can't see because your wrinkles on your eyelid are so bad. Is this true? Does it happen? Absolutely it happens. And it's actually covered. It's plastic surgery and it's covered by the insurances. But it's the only plastic surgery really covered. The other one is if your breasts are super big and they're weighing down on your chest and causing neck pain. Some insurances will cover that breast surgery, breast augmentation surgery. But in general, breast augmentation surgery is not covered by insurance, and plastic surgery for wrinkles not covered by insurance. But when it's for loss of vision, it is. When it's for neck pain from the breast being too big, it is covered. Okay? Otherwise, it's out of pocket. So, boy, did I go off on a tangent on that one, huh? Nikki? We got 30, maybe 1 minute left, Dr. B. 1 minute. Yeah, just 1 minute. And then we're going to move on to the piriformis next, guys. So we're going to end this live stream, and we're going to do we're going to start it up and do a piriformis release. So, yeah. So if you've been watching, you know that back pain comes from 30 different things. The L4-5, L5-S1 discs are the most common reason people have back pain, and that's what we're fixing today. But other reasons for back pain include the piriformis muscle syndrome, and Henry will type that up for you. You can learn about it on our website. We have a page. As a matter of fact, Henry, why don't you just put a link to the page on our website?
Perfect.
For piriformis on the next stream.
Copy that.
I wouldn't put it on this one.
No worries.
This is a disc surgery. But we're going to end this broadcast shortly. I will take the rest of your questions and answer them. We will be back with the same patient with a second broadcast to do the piriformis muscle release, because she has butt pain in the butt, coming from a torn muscle in her butt.
We have another question from Katie, once more on YouTube.
Sure.
Asking, is it a possibility for problems to occur in the same area because of genetics?
I'm not sure I understand the question.
They have some background. I am 28 with a degenerative disc in the same area you're working on right now, L4 to S1. Mm-hmm. I had nerve pain radiating down to my left leg and severe lower back pain until I started exercising 4 times a week. Is it a possibility for problems to occur in the same area because of genetics?
Oh, yeah. So I think what she's saying is, I've got bad discs at L4-5, L5-S1. I had back and left leg pain. It's gotten better with exercising. And then is it due to genetics or will it come back? The answer is that pain is going to come back. It's 100%, not even 99. As long as you live, it's coming back. So what do I mean by that? Well, let's say, you get into a car accident and die, and it didn't come back. Well, then I was wrong, right? But most people that doesn't happen. They live for many years, till women at least 86 years old is average. The point is, as long as you keep living, that pain is coming back. Your disc is not healed. It's not fixed. It's just settled down a little bit, but the pain will come back. So my advice is get it fixed now before it degenerates. Is genetics a factor in disc pain? Absolutely, 100% it is. There's no doubt that back pain and disc problems run in families. Okay. I was a little heavy-handed with the incision. I did about 9 millimeters. Normally it's 7. We can turn the music off, guys. We're going to put 2 staples, and that's it. We're going to put some pressure because we don't want too much blood in the muscle. And then we're going to end the stream, but I'll take another question while we're getting ready.
Lastly, from Katie once more on YouTube asking, can weakness in the area be passed down through genetics?
Hold on, Drew. Can weakness in the area be passed down through genetics? Yes, definitely. It can, 100%. That's right. Weakness can be passed down. Disc weakness can be passed down. You are correct. All right, while we're answering, I'm just drawing the piriformis, and we can end the stream.